Hi, my name is Dr. Joylene D. Almeida and I'm a consultant obstetrician and gynecologist here to talk to you about the menstrual cup. So the menstrual cup is a new silastic device which has recently been invented as an alternative to sanitary napkins. We know that generally when girls have their periods, they use sanitary napkins or cloth pads to take care of their periods. But a new kind of a device, an alternative to this, is something called as a menstrual cup. Now this menstrual cup, a lot of people are very scared to use and they think that there are a lot of side effects and whether it will get stuck, whether they can remove it. But contrary to belief, the menstrual cup actually is a very safe device that can be used, and only thing that it requires is a little bit of learning. So people have to learn how to use the cup correctly and in the right way, and also to keep it clean, and all the problems with the cup can therefore be avoided. Now this menstrual cup is just like the sanitary napkin. It has to be, however, it has to be inserted inside the vagina. So before the cup is used, it has to be warmed and kept in a bowl of warm water, hot boiling water, to sterilize the menstrual cup. Then when the menstrual period begins, the menstrual cup is inserted into the vagina. Now the insertion technique requires a little bit of learning. So the first 2 or 3 months when the cup is being used, you have to use a sanitary napkin along with it, so as to make sure that there is no leakage. But once you get used to the cup, then you will not require to use sanitary napkins anymore. Now the advantage of the menstrual cup is that one, of course, it reduces environmental pollution. So every sanitary napkin takes around hundreds of years to decompose, and a woman in her reproductive life almost uses in a month, you can say, around 10 to 15 pads, and that takes a long time. So it is environmentally safe. The second thing is, for people who have allergies with sanitary napkins or pads, the menstrual cup is safe, and that is why it's good for people who have allergies to pads. It just requires a little bit of learning. So once you have sterilized the cup and kept it clean, the insertion techniques are two. One is called as a push down technique. So in the push down technique, you push down the cup, you hold it and you insert it into the vagina. The second technique is called as a C technique. So in the C technique, you place it like a C and then you insert it into the vagina. So this is the push down technique and this is the C technique. Now both these techniques are extremely safe, and sometimes it works for some people and sometimes it doesn't work for some. The other way of inserting the cup, of course, is directly. Now this cup, when you go to buy a menstrual cup, it comes in different kinds of sizes. One is small, and which is meant for teenagers and adolescents, and other one is for adults. So it comes in different sizes. You have to figure out the size that suits you the best. Another type of cup is a cup with a tail and a cup without a tail. So a lot of cups come like this without the tail, and a lot of cup comes with the tail. So the advantage of this tail is that it leads you to the cup. You break the suction of the cup and you pull it out once it is inserted into the vagina. So you insert this either in squatting position or while you're sitting on the western closet into the toilet seat, or squatting on the floor. You can insert it into the vagina. When it's being pulled out, you break the suction, or you break the suction and then pull on to the stem, and the cup can then be removed. So advantages of this: you can do activities like cycling, climbing, swimming, even during your menstrual period. You can avoid allergies to sanitary napkins, as well as it is very environment friendly. So a lot of myths about the menstrual cup, that it causes, some people think it causes cancer, some people think it can get stuck inside, but all these are myths, and the menstrual cup is extremely safe to use.